Hello, I'm Matthew Weinstock with a look at the June issue of Hospitals and Health Networks. Our cover story paints a picture of the new healthcare CEO. As writer Howard Larkin points out, the CEO of the future really needs to build on skills that we've kind of traditionally viewed as prerequisites for success. That new breed of CEO must understand the continuum of care and how to bundle services around that. They also need to be agile learners, and probably most importantly, be champions of change for their organizations. I really encourage you to read Howard's article. It lays out a pretty clear roadmap for what the next generation of CEOs should look like. But right now we're going to change things up just a little bit, and I'm joined by our own Genevieve Dysing to talk about the generations gap in healthcare and how that's impacting hospitals. Genevieve, thanks for being with me today.
Thanks for having me.
So you talked to Linda McCracken for the interview in this month's issue. Tell us a little bit about her. Who is she? What does she do? And why did we interview her?
Linda heads innovation and thought leadership for Accenture's customer relationship management program, and she also teaches at Harvard. It's really interesting because she has a lot of experience studying generations, differences in generations with physicians and patients. So she spoke to us about how physicians can take that insight and channel that into how they treat patients.
And so in the interview, she talks about the tipping point for the physician workforce. What does that mean? What is she getting at there?
It's really interesting because we're at a point right now where almost 50% of physicians are baby boomers. So it's really important for us to understand the differences across generations in the physician workforce. For instance, there's a different expectation across generations when it comes to how quickly one should move up the career ladder. So that's something that we definitely have to keep in mind when we look at this research.
One of the other things I thought was really interesting in the interview, was this idea of patients and how they interact with different generations of providers. Talk a little bit about what you and Linda discussed there.
Linda let me know how it was important for physicians to really understand how different generations communicate differently. So, for instance, millennials want to be more digitally connected to their healthcare experience, where baby boomers will typically argue more with their physicians. So it's something that, as long as physicians can keep these generational differences in mind, they can be better attuned to their patients.
And so lastly, Genevieve, let's bring this home to our readers at C-Suite in the hospital. How does all this influence how they make decisions?
It really comes down to having a common vocabulary. If we all can get over the differences between our generations and use the same language, we'll have an easier time diagnosing our patients and moving forward.
Great. Thanks for talking to us, Genevieve.
Thanks. It was my pleasure.
And I'm joined now by senior writer Paul Barr to talk about an innovation that took place at North Shore Long Island Jewish in New York City. They've created a technology that stands the chance to revolutionize the way care is delivered for some patients and take billions of dollars out of the healthcare system in terms of expensive drug therapies. Paul, thanks for talking to me.
Thanks for having me.
So let's talk about what happened at North Shore LIJ. It's a pretty interesting story.
Kevin Tracy, the president of their research institute, many years back was doing research into inflammation in his role as a neurologist. He had a personal interest in it and was trying to determine what the causes of inflammation were. They stumbled upon the fact that electronic impulses through the nerve can affect inflammation. And so they've developed some treatments based on that.
And so let's talk about that technology. What is it? What does it do?
Basically, they took a device that's like a pacemaker and they implant it in the body and they tell it to do specific things through the nerve. Unlike previous pacemakers, which were more general and sort of dumb devices, these are more smart devices, and they either replace or prevent impulses to affect the way the brain tells the body to react to whatever is happening.
So let's put this into some kind of perspective then. How big of a slice of the pie are we looking at with this kind of technology? What impact could it have on the field?
Well, in rheumatoid arthritis alone, where they're first trying to use the technology, they could save up to at least $20,000 a year per patient who is on the biologic drugs. That the total spend on rheumatoid arthritis from a broader perspective is over $6 billion a year. So if they can just get a quarter of that, the savings would be significant. And the patients would be much better off because the drugs that they're taking are not very pleasant to take.
Right, so it's a bit more of a humane way of treating the disease then, it sounds like. So what's next? When can we expect to see something like this on the market? Are they even at that point yet?
They're in the second phase of trials in Europe. I don't think they've began trials in the U.S., to my knowledge. But one of the representatives for the Research Institute estimates that within 5 years it could be in use in the U.S.
And so do they foresee other applications for this? Could it be used beyond rheumatoid arthritis?
They've already begun trials with Crohn's disease in a very similar fashion, and they just announced something they hadn't told me about, and that's a use of the device to stem the flow of blood. What it will do is tell the spleen to react to the leakage of blood more quickly and cause clotting faster.
Well, that's great stuff. Paul, thanks for talking to me.
Thank you.
And so for all those stories and much more, be sure to check out the June issue of Hospitals and Health Networks. I'm Matthew Weinstock. Thanks for tuning in.